Dr. James Marks comes to us from the Robert Wood Johnson Foundation, where he's a senior vice president and director of the health group. He has also served as an assistant surgeon general and was a director of the CDC, National Center for Chronic Disease Prevention and Health Promotion. Dr. Marks will describe the Robert Wood Johnson's Foundation work to address childhood obesity today.
Thank you, Madam Chair, and other members of the subcommittee for the opportunity to testify this afternoon. The Robert Wood Johnson Foundation has committed $500 million over the next 5 years in an effort to reverse the childhood obesity epidemic by 2015, only 8 years away. We'll focus on improving access to affordable, healthy foods and opportunities for safe physical activity in schools and communities. Our goal is to reach the children at greatest risk for obesity across the nation. We've already heard that childhood obesity is one of the most pressing threats to the physical health of our country and our children. It truly is an epidemic. It is also an enormous fiscal and financial threat. In addition to the diabetes that we've already heard about, the children are also at higher risk for heart disease, stroke, and several forms of cancer as they age. These diseases and their costs are a debt that we will have to pay as a nation in the near future. The current direct and indirect costs associated with obesity in the U.S. are already estimated at $117 billion annually and growing substantially each year. As a nation, we simply can't afford to continue to hope that more expensive treatment and more intensive technology is the way to solve our medical problems. What has caused the epidemic? As a society, we have dramatically altered the way we live, learn, eat, work, and play. A generation ago, most children walked or biked to school. Today, only about 10% do. A generation ago, most schools required daily physical education. Today, less than 10% do. A generation ago, most kids went out to play games. Today, playing a game means on a video screen. And as we've heard, they're eating more unhealthy food in ever larger portion sizes. How do we reverse this epidemic? Schools are a central and critical place to start. Many kids, especially of low income, consume most of their calories at school and spend the majority of their waking hours there. We need the policies that make the types of food and beverages offered much healthier and greatly limit the access to soda and junk food, and that promote physical activity for students. In my written testimony, I've described several of the Foundation's supported initiatives in schools and communities, but I can only touch on them briefly here. Congresswoman Woolsey described her experience with the Alliance for Our Healthier Generations Healthy Schools program, which is working to improve nutrition and physical activity in schools. To date, the program has reached nearly 500,000 children in about 900 schools. You've heard about the hands-on assistance and support. We hope to expand its reach even further in coming years. How do we know that strengthening school policies will work? In fact, we're already seeing signs of progress. In 2003, several years before the federal level support, Arkansas passed a comprehensive law to address childhood obesity through school changes like those we're discussing here. An analysis that we funded of the Arkansas Body Mass Index data found that in just 3 years, Arkansas halted the progression of the childhood obesity epidemic in that state. We hope to see similar comprehensive efforts take hold across the country, and that you, as policymakers, would provide the support to help make that happen. We know schools don't exist in silos, and we must consider the communities in which the children and families live. We're also supporting community programs to bring healthy foods, and grocery stores especially, back to low-income communities where they're often not available. What else can government do? As the Institute of Medicine pointed out last year, our nation's efforts to prevent childhood obesity have been too small, too slow, and too fragmented. Missing is the sense of national urgency. To put more bluntly, as the problem has grown, our federal resources have shrunk. In recent years, funding for a number of CDC prevention programs and other similar efforts have been cut dramatically or eliminated. Although as a foundation we're committing $500 million to fight this epidemic, those cuts are cumulatively larger than our $500 million contribution. There's no way philanthropy can replace what government can and should do. For example, at CDC, the highly effective Verb Media campaign, which reached millions of children and encouraged them to be, and was successful in getting them to be physically active, was cut to zero last year. The STEPS community grants from CDC aimed at communities to prevent obesity and diabetes is slated for nearly 50% cut this year. We're moving in the wrong direction. When I visited Texas in the past, I heard a saying used that a person was all hat and no cattle, meaning all talk and no action. We can't succeed if that criticism can be leveled at our government. We need action that only government can provide. Congresswoman Woolsey's bill is a big step in the right direction, but only a step. And Congress could take another step as it considers reauthorization of No Child Left Behind. We urge you to put physical education back into schools. It's taken us over 30 years for this epidemic to occur and for us to begin to grapple with it, and it will take years and many steps to reverse it. We also know that this problem will require the efforts from the private sector, state and local level government, community groups, and from parents and families. There is an African proverb that says the best time to plant a tree is 20 years ago. The second best time is now. 20 or 30 years ago was the best time to address this childhood obesity epidemic when we could have prevented it. Now we must, all of us, work hard to reverse it. But this is the second best time. Thank you, and I look forward to your questions.